Hello friends and greetings from VLCC and a very good evening to all of you. I'm Dr Anju Ghei, Vice President and Head Preventive Healthcare at VLCC, and I'll be your host for the session today to understand what urinary tract infection or UTI is and what causes it, how to prevent it and cure it. So our expert panel includes Dr Ashok Sarin, India's leading nephrologist, and eminent cardiologist Dr Dhiraj Bhatia, and nutrition expert Dr Deepti Verma, each of whom you'll meet shortly. And of course, you know about VLCC with 310 locations in 143 cities across 12 countries in South Asia, Southeast Asia, GCC region, and East Africa, is of course the leader in beauty and wellness arena. Our wellness program is recommended by IMA, the Indian Medical Association. And today's session, as always, is part of our monthly webinar series, our educational contribution to holistic wellness through quality information and healthy lifestyle choices. So before diving into the topic, let me first set the stage. So urinary tract, what is it? Like, urinary tract is part of our body's drainage system. It removes urine, which is made up of our body's waste and extra fluid, and it includes 6 organs: 2 kidneys, 2 ureters, a bladder, and a urethra. So these 2 ureters, they bring urine from kidneys to the bladder, and from there the urine comes out of the body through urethra. And for normal urination to occur, all these parts, they need to work well and in correct order. So males have longer urethra than females, and they also have a prostate gland, which often affects their ability to pass urine freely as they get older. The male urethra transports both semen and urine, while in females, the urethra transports only urine. But our urinary tract is so beautifully designed to keep the bacteria out, but bacteria can still make its way in. So the urethra is the connection from the inside of our bladder to outside of your body, and that's usually how bacteria gets in. So UTI is bacterial infection of urinary tract, and the infecting bacteria, they multiply quickly, and most of the time the infection will be in your bladder, but ultimately it can be anywhere along the tract. At some stage or the other, most of us have experienced UTI, and I'm sure we have so many questions. So our panel of experts will address a wide spectrum of common queries which we have received from you during registration for this webinar regarding UTI, and these include the causes, the symptoms, the diagnosis, its management, especially in young females during pregnancy, the menopausal women, elderly men, prostate with prostate enlargement, and also the chronic recurrent infections, the dietary approach, and also some exercises, how to help those who have a leaking bladder. So there's so much to come. So I will therefore now invite our panel experts to address them, and I'm so delighted to welcome and introduce to you our first panelist for today, Dr Dhiraj Bhatia. Dr. Bhatia has over 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Fortis Escorts Heart Institute and Research Center and Max Super Speciality Delhi. He's in fact been honored twice by DMA and IMA as their Doctor of Excellence awardee, and he's been also part of core medical research team which has laid down guidelines for defining and management of obesity and PCOS in Asians. And of course, he is the senior medical advisor to VLCC for the last 20 years. Good evening, Dr. Bhatia, and welcome to the webinar. And thank you so much for joining us today.
Very good evening, Dr. Anju, and good evening to all viewers, and especially to Dr. Ashok Sarin, a very, very dear and old friend of mine. Dear, young, but old from all the years. That is very, very old. Okay, so Dr. Anju, let's set the ball rolling. What was the first? I think you have a lot of questions from our viewers.
Yes, absolutely. We have a lot of
Let's
questions.
go with, let's make it interesting with, question and answers.
Okay.
So whatever you say.
Right. So the first question, Dr. Bhatia, to you is, what exactly is urinary tract infection, and are there different types of it, and who is more susceptible to it?
Right. So basically, urinary tract, as the name implies, infection. It's basically an infection. And the commonest kind of infection you get is bacterial, which most women suffer sometime or the other in their life. There are certain susceptibilities, which we will go into very soon. But usually the bug is bacterial. And rarely, of course, we come across fungal infection also. Fungal is more in cases of people who are immunocompromised, or people who are severely uncontrolled diabetics in that group. But by and large, we see a lot of infection, bacterial, and even in people who don't have any risk factors. So that's interesting. And there are couple of reasons for that. We'll discuss that as we go along. The commonest bug is a bacteria called E. coli. Escherichia coli, and that is what is very, very common. And the question which you asked was, what is the susceptible group?
What are the different types of...
different types. Right. So types, they're defined into lower and upper. So as the name suggests, the bladder is lower. So it's all around that area. So then we say cystitis, So that is one group which is defined as the cystitis group, or the lower UTI. And the upper, and in that you include your urethra also, which is the outlet portion, the last part of the drainage. And then you have the upper, which is pyelonephritis. Now that's the dangerous one, because as the infection goes up, pyelonephritis means literally like pus in the kidneys, in a way. So you're affecting the kidneys if you're not treating it, at the first level, which is the lower UTI. Of course, you can get an infection straight of the kidneys. That's a different issue. But usually it kind of moves. And then, of course, the symptoms are different. We can just discuss that later. But the other part which you said, who are the people
who are the people who are more susceptible?
Right. So, usually it's more common in females. And more common in females because E. coli usually comes from the fecal matter. And in females, the anus is closer to the urethra. Much closer. So therefore, the infection is passed on, especially, you have to be very careful about hygiene. And then if they have diarrheas or chronic diarrheas, so that can happen. Then diabetics, people who are obese. Very important, they say 80% today in the West, of course, India studies are not there, but abroad, 70 to 80% of the cases are because of indwelling catheter. So people who land up in hospital and who have a catheter, indwelling catheter, because they're not passing urine post-operatively or because of age or some neurological problem, there's a very, very big group where there's this mega problem. Then, of course, vaginal infection can cause it. Recurrent UTI, people who have had UTI in the past, maybe there's a genetic predisposition, but they will keep having it again and again. Pregnancy is another very big group. So pregnancy also, one should always keep in mind, when the frequency increases, that's another very big group. Right. So these are then of course, people who had renal transplant and, people who are in renal failure, immunocompromised. There's an, excuse me, and in male who have got a prostate enlargement. So this kind of group also has a problem. Yes.
Absolutely. Thank you, Dr. Bhatia. And the next question is again, people are wondering what kind of symptoms indicate that you have a possibility of UTI. Yeah.
So symptoms, again, you divide them according to what type. Like you said, what are the types? So there is lower and upper. So lower means bladder. So bladder symptoms are going to be what? They're going to be like, increased frequency, burning, and then dysuria. Dysuria means painful micturition. That's very bad. They cry out. They feel that somebody is cutting them inside with a knife. So that is a terrible kind of feeling they get. Then they get this suprapubic pain. So that is the thing. Now, when it shifts to the kidneys, which is called pyelonephritis, the symptoms become more intense. these same symptoms are there to repeat. They have dysuria, painful urination, increased frequency, running, urgency, they have this thing to, sometimes they say we can't even reach the bathroom and we just pass urine. But as it gets worse, then fever comes on, and that means pyelonephritis. So that is then they get a lot of pain in the flanks, in the renal angle, at the back. So they complain in the lumbar region. They start complaining of a lot of heaviness or even acute pain. And then they get fatigue, tiredness, nausea. They feel fever comes with chills. So, chills, like a lot of people, differential diagnosis, when you have personal fever with chills, always first think of malaria. And then the second you think of a UTI. So dengue, of course, also you have chills. So these, this is how we can tell. But then in these cases, you will have, of course, now you will always find that people with this pyelonephritis symptoms, like this fever and pain in the flanks, they don't come in. These symptoms are not there when there's a bladder problem. But the bladder symptoms are always there when there is a kidney problem. That's interesting to note.
Right.
So that is very interesting, especially this nausea, fatigue, flank pain, fever, chills. That means it's ascended. And that's the red flag. Then you need to be really careful and alert. Right.
So, Dr. Bhatia, are there any other medical conditions like which display the same symptoms as UTI and we get confused with it?
Yes. So, I think you need to take a doctor needs to take a very good medical history. So, if a lady has, let's say, a vaginal infection, right? Vaginal discharge or infection, and there is inflammation there, she'll again get the same symptoms. She'll get an urge to again, urinate again and again repeatedly. So that's going to be an issue. So a good history, if there's any vaginal discharge, foul smelling or otherwise, one should always take. Then people, who are taking a lot of coffee, the frequency will increase because of caffeine. Right. Similarly, even colas have a lot of caffeine. So there you go. People taking a lot of tea, there can be a problem. People who do not know that they are diabetic and suddenly they become diabetic. One of the first symptoms the first symptom really is fatigue and passing more urine. Frequency increases. And that's why you pass more urine, then you're going to start feeling thirsty because your mouth is going to dry up. So again, taking a history about that is extremely important. So pregnancy is another very important part. Pregnancy, a person may not know she's pregnant, and her first symptom may be that her frequency is increased. So therefore, it's a good idea to find out when the LMP was the last, last menstrual date. Then a history of diuretics is very important. Are you taking, Lasix, or you're taking some other diuretic which causes increased urination? Prostate enlargement. That itself, because it presses on the urethra, without having it, you can have this problem, the increased frequency. So these are some of the important kind of things which we look at. Yeah.
Thank you, Dr. Bhatia. And we started with the bacteria which infects our urinary tract. And so, according to you, what is the most dangerous bacteria which can infect the UTI?
The most dangerous bacteria is Pseudomonas. The most common one is E. coli. So E. coli, the management, I think Dr. Sarin is the best person. He has vast knowledge, so I'll leave it totally to him. But commonest one is E. coli, and the most dangerous one, Pseudomonas, which I would actually treat by injectable, especially if it's hospital acquired. But since I think we are really to just wind off, since we're talking more about preventive thing. Right. So he will of course take the management, but since we're talking about the preventive, a few tips for the viewers. One is never hold on to your urine as far as possible. Try to pass and drink sufficient amount of water. You hold on to your urine, then there are issues of stagnation, especially if the prostate is enlarged. So I would advise one thing is never do that. Drink plenty of water. Very important part is when you wipe, in case one is using swipes and not using water, especially in public places, then always make sure that one does not wipe from the back to the front, because you're taking infection from the anal region, the fecal matter up in the front, and that's how the infection comes. So you make sure that you're always wiping from the front to the back. It's a simple tip like this. Also very important is people use condoms. There are condoms which come with spermicides, and those condoms with spermicides should not be used. A lot of people don't realize, the youngsters, they use the one with spermicide. The spermicide, why it creates a UTI? Because it changes the flora of the vagina. Simple thing. That's the reason. So just use a simple plain condom, not the ones which come, these fancy ones which you get from wherever. And one should really. And lastly, whenever one has sexual activity, one should, even if it's middle of the night and one is tired, get up and pass urine. It flushes the system out.
Right.
So these simple tips, which I think it's very important. Drink a lot of water. Don't hold urine.
Very useful.
Yeah.
Very useful, Dr. Bhatia. And just to end, what would be the simple investigations required to rule out the UTI?
Always start basic. So basic is urine routine. Just get a urine routine. Usually if it's pus cells, a lot of people ring me up and say, Doctor, we had 4 to 5 pus cells, Doesn't matter. The pus cells have to be 6 to 7 at least before you culture. You find something on culture. And then, of course, they look under the high power field. It should be 10 to the power of 5 per bacteria, lying there. Then okay, you're going to culture something which is going to be there. So urine routine is very, very important. More than 6 to 7 pus cells and some pus, I would be worried. Urine culture will give you a clue. 48 hours, 72 hours culture will tell us. Thirdly, I would do an ultrasound to see there's no obstruction, which is another big risk factor. Any stone there, or in children, if there's any congenital defects of the urinary flow. Because whenever, river is not flowing properly, it's not going to be clean. There's going to be stagnation and there's going to be a problem. Last comment, that we have something called, you see a lot of pus cells in the urine. Let's say 40, 100, 70. When you culture it, you'll not find anything. And people wonder why. So there are 2 important causes. Very important causes, which I think the viewers should take home. One is it could be renal tuberculosis. So that we call sterile pyuria. Sterile pyuria, which means there's pus in the urine, but there's nothing growing. But then you have to do different kind of cultures. And we do something called PCR. Those polymers, that's a new thing, polymers chain reaction. Also, some collagen disorders also behave like this. Collagenosis, like SLE, you will have a lot of pus cells, you will not have this. I think enough for the day.
Thank you so much, Dr. Bhatia. So for the viewers,
we've got a legend sitting with us. He should take. Dr. Sarin is a legend. He should take over.
Thank you so much. So you just need to get your routine urine, and then if required, the culture, and then ultrasound if required. Just leave it to your doctor to decide, and that's what is going to work for you. Thank you, Dr. Bhatia, for laying the foundation for today's discussion. And let's go forward. And I'm so very pleased to now introduce our special guest on the panel, Dr. Ashok Sarin. Dr. Ashok Sarin is Senior Consultant Nephrology with Apollo Hospital, New Delhi, where he's worked for over 25 years, and he's been the coordinator in the Department of Nephrology as the thesis guide and teacher for D&D candidates. His experience stretches from All India Institute of Medical Sciences in Delhi to the Belfast City and Royal Victoria Hospitals in Belfast, Northern Ireland, where he trained in nephrology and cadaveric renal transplant. Dr. Sarin is Fellow of Royal College of Physicians, Edinburgh, and has been President of Delhi Nephrology Society and President of Indian Society of Nephrology, North Zone. So, welcome to you, Dr. Sarin. Welcome to you to the webinar, and thank you so much for joining us today.
Thank you very much, Dr. Anju, Dr. Dhiraj Bhatia. It's been so kind of you to have invited me. Now, what, are you going to ask me questions or?
Right. There are some questions for you, Dr. Sarin. So let me start with the first question. So the simple one is, what are the causes of urinary tract infections actually?
Look, the most important causes are in men and women is obstruction. Now, obstruction anywhere in the urinary tract, like stones, like stricture urethra, PUJ obstruction, which is high up in the kidney, stones, renal stones, and then in men, prostate. So these are the common obstructive elements are very important in the cause of urinary tract infection. Then also an immunocompromised host. Now, a person whose immunity is down due to diabetes, due to glycosuria, there's a lot of sugar in the urine.
Right.
And bacteria love sugar, and therefore the person with diabetes is going to develop UTI very readily, very commonly. Then immunocompromised host, a patient who's on steroids. Steroids are used in the treatment of many diseases. Patients who are on steroids and other immunosuppressive medication, for example, in our patients, renal transplant and all that, I won't go into the details. So immunosuppression is another reason, and obstruction.
Right.
Catheters, as Dr. Bhatia had already mentioned, catheters, and then of course very commonly, the simple urinary tract infections are because women and men are not drinking enough water. We are living in a very hot climate in northern India. As a matter of fact, it's all over India.
Right.
The climate is very hot, it's very humid, and very often we get UTI just because we are not drinking enough.
Right.
And then as Dr. Bhatia had said that, women sometimes, because we don't have toilets readily available, they don't pass urine. And you'll be quite surprised to hear that once I had a patient, which does not happen commonly, who had renal kidney failure because she was in the habit of not passing urine for the whole day for almost 24 hours. Wow. And she would pass urine late in the evening in her house. And then she developed back pressure changes and it's not common, but women, as Dr. Bhatia said, should pass urine regularly and must drink a lot of water.
Right.
So these are some of the common causes.
Right. Thank you so much, Dr. Sarin. And of course, we touched upon the UTI, which is so very common during pregnancy. So what tips do you have for our viewers for that, Dr. Sarin?
Look, if ever a woman who's pregnant gets urinary tract infection, she'll have symptoms like burning or whatever, and fever also, then the urine should be examined, urine routine and urine culture. And if it is positive, as 10 to the power of 5, it should be treated with simple antibiotics. I very often get in touch with the obstetrician, where in conjunction with her, because she has a fetus, I don't want to give antibiotics which can be dangerous to the fetus. So simple antibiotics like dipropyrantoin or trimethoprim can be given to these patients for a short duration. Right. Because UTI can cause problems, it can cause premature rupture of the brain, can cause low birth weight babies, and if it spreads into the mother, it can cause septicemia, which will harm the mother and the fetus. So, it must be treated very quickly. It can be treated by simple antibiotics.
Absolutely. So, yes, so like Dr. Sarin has just mentioned, this is for everybody. If you notice any symptoms of UTI, if you're pregnant, please do not ignore and seek medical opinion at the earliest, because untreated UTI can cause complications and which can become really serious during pregnancy.
Even abortions and miscarriage is common in pregnancy just because of UTI.
My goodness.
Which can be treated very easily.
Absolutely. So the message is loud and clear. Do not delay. Just immediately get in touch with your doctor and get treated. So, Dr. Sarin, is there any difference of approach while treating the menopausal women?
Yeah, menopausal women, because of vaginal atrophy, we must use these estrogen preparations as creams. And because the bacterial flora is lost and the lactobacilli and all are lost, so they readily develop urinary tract infection. So if we apply these estrogen creams, then we can keep these harmful bacteria away and can get the lactobacilli and all in the urinary tract, which will ward off harmful bacteria.
Absolutely. So
there's no role for estrogen tablets in this case. It's only local creams.
No, that's about it. So the local estrogenic creams are required just to take care of the dryness.
In vaginal atrophy.
Absolutely.